Hi, it's Dr. Mary Trumpi, and this is Relieve 24/7.
I think I benched and I didn't properly warm up my elbows.
Okay,
So this area right here
that would
starts
be
to hurt
good.
when I hit chest.
It's tricep tendonitis. Feel that right there?
Yeah.
Yeah. So,
Right behind that freaking tricep.
so tricep tendonitis sucks because it's just from all the heavy training you're doing. Is it right there?
Yeah. What's the worst that can happen if, like, worst case scenario?
It just gets more annoying. You won't tear anything. This is very unlikely to tear here, but you might want to stretch your triceps more when you're. Am I on it?
Mm-hmm. Right there.
More here.
Yeah.
Less here, correct?
Let's look here.
Okay.
Right there.
Up in here. There too.
Mm-hmm.
Like if you let me do a session on your tricep and loosen this whole thing. Ready? 5, 4, 3, 2, 1. Totally would help. Feel how tight that is? And then it comes and attaches actually through there. Okay. For example, this is the cryo machine, and you can actually see over here if you want it to be less or more. The laser beams let us know exactly where to go. He has a little tricep tendonitis. It's pretty neat over here. This tells you the temperature of the skin. For example, I'm not on it here, but if I hold it here a little bit, even on my hand, see it now, it's getting down 66, 66. Cool. Localized cryotherapy. Nitrogen-cooled beam of very cold air directed at an area of inflammation. He has a little tendonitis of his tricep because his triceps are so muscular. He's been training hard, causing a little stress right here. With localized cryotherapy, it's important to keep moving so it doesn't bother the skin. These two beams let you know exactly where to go. See, you go till they become one. Now it says you're too close. 3-4 minutes per body part can really help injuries, can really help you recover, and feels good. Temperature okay, Carlos? Do you get much discomfort up?
No.
Right in here, correct? Okay. Below the elbow at all?
No.
Right above, okay. Feel okay?
Feels very, very cold.
And it's kind of interesting because you can see over here, if I keep doing it
Like red ice.
like that, and now it's got down to, like, see, it gets so cold, it'll tell you when to turn it off. Like, sorry, Carlos. You're at 66, 62, and then if it gets too cold, this little machine gives you a thumbs down, so it's almost like injury proof. So my buddy here's got a little tricep tendonitis. What I'm doing here, this is a style, it's called active release therapy, to where I'm holding the muscle and bending him. So I hold the attachment and I let the tricep, as I bend him up, you okay? Mm-hmm. Bend more, bend more, bend more, bend more, bend more. Okay? And then when I can actually have the patient active release, the patient actively is helping me release then. I'm going to hold this. What I want you to do, yes, pull it down, pull it down, pull it down, more. Come back up. Very good. And breathe in. And bend the elbow nice and slow. 5, 4, 3, 2, 1. Come back up. Doing great. Breathe in again. Go nice and slow. Slower. 5, 4, 3, 2, 1. Come back up again. In. And here we go. 5, 4, 3, 2, 1. Come back up. You don't have to do too many strokes like this. 5, 4, 3, 2, 1. One more time, Carlos. Breathe in. And out. Good. Stretch it. 5, 4, 3, 2, 1. Good. So active release, if you can do that on most body parts, you shorten the muscle, bend it out, you're actively releasing the tightness, and you kind of help me do it. Okay? Perfect. That might help you out a little bit. Okay?
Thank you.
Feel good?
Yes.
Okay. Localized cryotherapy is similar to the full body machine that you get in that does full body cryo. Localized cryotherapy is a handheld device that actually delivers a very nitrogen-cooled stream of air specifically to an area that's in pain, inflamed, there's swelling. What it does, it's so cold, it drives, let's say my wrist hurt, right? You would aim the beam right here, very, very cool air. What it does, it stops pain, inflammation. Then when you remove the very cold air, fresh blood rushes back in, bringing oxygen to the tissues to help you heal. It's not dangerous, no. You would just not want to have it too close, and the machine is built in with 2 lasers that tells you exactly how close to get to the skin. It wouldn't really freeze you or burn you, but you would just, just be cautious on who's applying it to you. One thing you would not want, you do not want to do localized cryo on an area of your skin that is wet. So no sweating, no post-exercise. Make sure it's dry because it might burn the skin. You know what? I think optimally, if you can handle an ice bath, that is probably beats any cryo, localized or full body, just because it's, I think you can get the same temperature. I would suggest getting your cryotherapy post-exercise, just because you may, you maybe get some inflammation, especially if you have an injury, and blood flow, exercise, cool it all down, help you recover. You should probably get a cryotherapy at least, if you have an injury, once or twice a week per body part. And one of the things that people might not know, okay, so I do chiropractic, okay? So it's chiropractic, okay? Cryo actually comes from, I think, a Latin term that means hand, okay? So that's how we were taught, that's what chiropractic means. Now, what we're doing in back is cryotherapy, which is the difference, okay? This is what I do to people with my hands. Cryotherapy is the handheld device that cold, delivers the cold air for recovery, okay? So some people know, they're like, chiropractic, they don't know how to pronounce that. So this is the therapy, and this is chiropractic.